This discussion is going to look at the recognition of drug abuse and some of the rules regarding drug testing and illegal substances in sport. So do a little talk on some of the general characteristics of substance abuse, relate those to certain types of substances, and we're also going to be getting into drug testing policies. We're going to be looking at what are kind of some of the benefits to doing that, along with some of the things that become difficulties, particularly for the high school level and at the small college level, to be able to conduct drug testing. So just a little overview of the actual chapter itself. Make sure you've read chapter 15 in your textbook. We're going to look at the recognition of drug abuse, again, basic signs and symptoms that we see with that. We'll look at some of the different levels of drug testing that goes on, and talk about when individual institutions want to do their own drug testing. And there's an example from your textbook, the University of Las Vegas, Nevada. They outline their individual drug testing policy that they have at their institution, and we'll talk about what goes into that and what the role of the athletic trainer is in kind of managing this situation. So with recognition of drug abuse, something to be mindful of when we look at patterns of drug use, particularly as it relates to the NCAA, you see here in the same charts in your textbook, most drug abuse or use is going to be primarily for the ergogenic benefit. So in other words, an athlete wanting to get bigger, stronger, have more energy is the reason why an athlete would use a drug of this type. If you notice on the patterns, and your book discusses this, and it's an important point, it's been interesting that the use of steroids has actually dropped quite a bit. I don't know in recent years, that your book was written a little while back, if that's gone up or not at all, but you notice the use of anabolic steroids dropping and the use of amphetamines and ephedrine going up. So the pattern here that you see more recently is the use of drugs used for more stimulant-based purposes to give athletes more energy. So it's not so much that they're utilizing drugs, obviously based on the results of this, to get bigger and stronger, but they're just looking for more energy in general, and regardless how they're looking to go and utilize that. General characteristics of substance abusers. So we have a couple of them listed here. Your characteristics you typically see individuals with mood swings, depression, anxiety, headaches, just general behavior problems that are unusual for an individual. Aggressiveness, win at any cost attitude. I would like you to refer to your chart page 209, table 15.1. They list different types of drugs and specific characteristics that relate to the characteristics of substance abuse that you'll see in those individuals. So take a look at that chart and be able to make some connections between some of those characteristics and the specific drugs. With the popularity of supplements being used by athletes, it's really important to educate athletes on the fact that sometimes there can be unknown ingredients, some of which can actually produce, even if something's sold over the counter, can produce a positive drug test. And sometimes the amount of a certain substance in the supplement can actually be more or less than what's actually stated on there. So it's really important that individuals, again, for you as an athletic trainer, to educate individuals appropriately if they're looking to use supplements. A resource that can be utilized, NSF, actually has a certification process that certifies supplements. So this is certainly a resource that can be utilized for athletic trainers. There's a lot of supplements. If you go to a store, you may see some ergogenic, supplements that are deemed ergogenic with this NSF seal on it, showing that it's been a certified supplement. So just something to keep in mind when discussing this with your athletes. Looking at some of the individual athletic association rules, the NCAA rules, just to kind of point out some highlights in regards to the drug testing. All athletes have to consent to random drug testing in the NCAA. If an individual athlete does have a positive test, they are out for 1 calendar year. This also includes postseason play as well. Once their eligibility is restored, if they test positive again, with the exception for street drugs, they lose all of their eligibility. So that would be the kind of ramifications of the second test. Failure to consent to the test would equal a positive test. So if an athlete were to get tested, if they were selected for random testing and they refused testing, they would automatically be deemed to have a positive test. Really important with this is the importance of confidentiality. So, and part of the reason for that is there is a chance that an athlete could have a false positive. So it's really important that if a false positive test is found, that to avoid issues with that information getting passed on, that they make sure that the test was not a false positive. So make sure that as a part of the retesting process that has been kind of carried out before anything gets out, because obviously there could be a lot of very negative consequences for the athletic trainer, for the institution, and more importantly for the athlete who was found to have a false positive test. So really important that the confidentiality process, that the confidentiality procedures are kept in place. In looking at individual institutions, all athletics departments should have some sort of drug policy implemented, particularly as it relates to alcohol, tobacco, and any other drugs. It's important that they implement that policy and that the legal counsel of the institution is involved as well. So, and again, the policy should include an education program on the NCAA regulations and in regards to drug issues. So that's an important thing to be included. Now, whether or not individual institutions will have their own individual drug testing could be another issue. But that's certainly something that could be in place. But at the very least, there should be some sort of written policy that the individual department should have in regards to drug use. Now, your textbook uses the example, the University of Las Vegas, Nevada, they developed their own drug policy where they also do random testing. So here, this is just outlined just to give you an example as far as if a similar institution would develop a policy, what they should be doing. So there's both random testing, both in season and out of season. As discussed previously, confidentiality is paramount. So again, you have to make sure, and again, but the big thing with confidentiality, I mean, just for health concerns in general, obviously the confidentiality is important, but also in particular with the instance of a possible false positive test. So what I'm going to go through here is what a first positive test entails, what a second positive test entails, and what a third positive test entails based on the UNLV drug policy. So in referencing the example given for the UNLV drug test, the first positive test results in a written reprimand of the student, immediate suspension and dismissal from the team. The individual must be willing to submit to random drug retesting, after this, and they'll also, and this is really what is the most important part of this, they're going to be referred to counseling and psychological services. So what this is going to do is give them a route. Again, a lot of these policies aren't put in place just to punish people, they're put in place to help them get help. So they will have access to counseling services, which really, again, is the most important part of all of this. So while, obviously we're concerned about the fairness aspect and everything as it relates to drug testing, but, even more importantly for other drugs that maybe aren't considered ergogenic drugs, particularly for street drugs and things like that, it's important to get the person, help and the necessary outlets that they need to kind of get them over their problems. The second positive drug test has similar aspects to it. Again, counseling and psychological services would be a big important part of that. They have to submit to random drug retesting, suspension from a minimum of 20% of practices and competitions, and then possible residential or long-term counseling would be an added thing to the second positive drug test. The third positive test would result in a permanent suspension from both practices and competitions. So they would basically be dismissed from their athletics team, and if there would also be an appeal process through the director of athletics if a third positive drug test were to come up. The NCAA banned substances list, and if you go to table 15.2 in your textbook on page 211, the banned drug classes. So it's important to know and understand the categories and kind of what falls into them. So for instance, you have your stimulants, you have your anabolic agents, which would obviously include the different types of anabolic steroids and the different types of pro-hormone substances. Your sports-specific substances, if you look at, for instance, alcohol and rifle, and some of those other particular drugs, you have your diuretics, your street drugs, and then your peptide hormones, things like HGH, HCG, and those other substances. So take a look at that, and again, the important thing there would just be able to recognize if you were asked to, if you were shown a drug, you'd be able to place it in one of those categories. The International Olympic Committee, long known for their drug testing, the drug testing organization is actually a separate organization that is involved with that. It's the World Anti-Doping Agency, WADA. The link to their website is up here. You could look at that. On table 15.3, they have the classes of drugs prohibited by the International Olympic Committee. Very similar to the NCAA. There's some exceptions. Again, an important note, and this goes for both the drug substances prohibited by the IOC and the NCAA. There are some drugs that are on the list but are legal to certain levels. Probably the best example of that is caffeine. Okay, so caffeine is on the banned substances list, but there is a legal amount that can be present in a test. So, and then as we talked about with caffeine, the interesting thing, what's interesting enough about that is caffeine at ergogenic levels. In other words, what can give an athlete a benefit is actually much lower than what the illegal level is. So actually at the levels at which it typically gets, or where it's classified as a banned substance, it actually shows decreases in performance. So again, that's something that you can obviously educate athletes on if an individual is going to decide to use caffeine. So again, please review that table again. Very similar, you have your stimulant agents, your narcotics, your anabolic agents, your diuretics, one that was added in a little more recently are the anti-estrogens, so Clomid and tamoxifen, which are both anti-estrogen drugs, and they a lot of times get used by individuals who will abuse anabolic steroids to prevent increases in estrogen, or sometimes they will just be used as the substance themselves. For instance, some males will use Clomid with the potential to suppress any amount of estrogen produced in their body and to get an ergogenic benefit from that. So make sure that you review those drug classes. So in looking at the Olympic athlete and drug testing, these drug tests can be random throughout the year. Just a random note. Marion Jones, and Marion Jones is noted in discussing this, more than 160 drug tests during her career. So again, at any point in time, an Olympic athlete throughout the year can be tested. And again, sport-specific, event-specific testing can occur as well throughout the year. With drug testing at the high school level, it is not a regular occurrence that does happen. Some high schools have started doing random drug testing. Initially, when drug testing started to become bigger in public high schools, it was initially challenged on the basis of the Fourth Amendment. So the Fourth Amendment is posed here. The Supreme Court ruled that random drug testing in public schools did not violate the Fourth Amendment rights of a high school athlete. So the concept is that if a student is going to play a sport, that they can be subjected to random drug testing. And this ruling has been upheld numerous times. There has been debate about doing widespread high school drug testing. However, the big thing is the cost associated with analyzing the samples. So, projected costs have been pretty high. So that's been the major roadblock to high schools doing this on a more regular basis, is the cost. So if in chance it would ever get more widespread, obviously athletic trainers would be playing a major role in the implementation of a drug testing policy at a high school. So as was discussed, the initial challenges came in certain states. Your textbook highlights the Oregon and Indiana cases. Again, in both instances, the court did rule that the drug testing was fine to do. Again, the biggest roadblock to doing this is the cost of such widespread testing. So in looking at doing it across the United States, they looked at the cost of being projected to be $1 billion a year. And that could possibly be a very low estimate of the actual cost. It is very expensive to do this, particularly for certain types of drugs. For instance, testing for anabolic steroids, at least 5 years ago when I was looking at the cost of these things was actually very expensive. So it does become a bit of a burden in that regard, a financial burden. But again, from the athletic trainer standpoint, if it were to be put into place, again, you would have a major role in that process. Some of the items brought up, there is the possibility that someone can beat a random drug test. Two of the more common ways that individuals will look to beat random drug tests, one is by actually buying clean urine. And some individuals will actually have another person's urine put into their body through a catheter in order to pass a drug test. So they'll have all their urine taken out, clean urine put in, and then go and be able to beat their random drug test. Another way, which is a little harder now because the drug testing actually tests for them, are using drugs to mask illegal drugs. For instance, diuretics were utilized, to increase the urine output to help mask drug use. But a lot of the masking agents are now tested for, so that's another thing that can be utilized as well. So a lot of the masking agents are now tested for and considered banned substances. So the role of the athletic trainer in substance abuse, it's important to understand you're not, as an athletic trainer, you're not a trained substance abuse counselor. You do get some basic counseling in your coursework, but you're not a trained substance abuse counselor. Your main responsibility is to help the person get assistance. Obviously, at the same time, you can be a good listener. You can, just talk to things with the person, but it's not your role to treat the person's substance abuse. So help the person get good assistance again, and so having a good knowledge of counseling resources is very important. One of the first things you should do when you get employed at a place is find out what counseling services, if you're at a school, obviously find out about the counseling services there, and because that's going to be your first step in trying to get the person help. And then also help the athlete with ideas on how to avoid the situations that lead to abuse. So you're certainly a resource for the athlete, but it's just important to know that you need someone with that higher level of knowledge as it relates to the actual counseling for the substance abuse. So, you're in an education role in referencing the individual banned substances, but when it comes to the actual counseling of the individual, there needs to be somebody else there. Certainly be in communication with that individual is very important. That being the individual counselor who would be assisting your athlete in that process. So for the discussion board, this will be up on the discussion board, so please answer this. Knowing that a high school you work at as a certified athletic trainer does have a drug testing program, how do you approach a football player you suspect is using illegal steroids? So think about that scenario based upon things that we talked about in this discussion. Think about that in regards to some ideas. Go to your textbook and formulate some ideas on how you would address that situation. And then a second discussion question. So some of your athletes you're working with are talking to you as the certified athletic trainer and asking you about some herbal-based energy supplements they are using to increase their energy during practices, which occur twice a day. What should your explanation to the athletes regarding the use of over-the-counter supplements be? So again, utilizing your information from this discussion, stuff in the textbook, information from the textbook, give a response to this. So both of these questions I'll be looking for your responses on Blackboard in referencing these topics.